The city of New Britain is one of few major cities with issues when it comes to putting the COVID-19 vaccine in Black and brown people's arms. Experts I spoke to say that this is a major issue and one that may require a new strategy.
At the end of the day, this is life and death, right? This is why we should all care.
Concerned healthcare expert Wilson Camello is urging state and city officials to reconsider strategies when dishing out information of the COVID-19 vaccine to Black and brown communities. Camello says, yes, the state as a whole is doing well in vaccine distribution, but peeling back one layer to see who is getting the vaccine, Camello says the state has more work to do.
Connecticut right now, in terms of the population over 75, only 1.9% of those vaccinated are Black, and only 2.3% of those are Hispanic. Now, let's keep in mind that the Black and Hispanic community in Connecticut is a little bit younger than the white population.
State officials point to some barriers already known preventing Black and brown communities on getting the COVID-19 vaccine.
And we know what all the barriers are: access to computers, access to the internet, access to information, transportation.
We may need to think of other factors in combination with age, but also geography, race, ethnicity, age, comorbidities.
New Britain, one of many major cities struggling to keep up with the rest of the state on vaccination, says access is also causing disparities. In a partial statement, New Britain's Mayor Aaron Stewart claims the city has only been receiving around 100 vaccines per week when she should be receiving 10 times that number, which in turn causes disparities. Experts say access, though, is only part of the problem and say the way information is distributed may be an issue as well.
People of color trust other people that look like us and are in our community. So making sure that we're using the right surrogates to deliver our message is critical. But so is the message. Who's developing the message? Is the message relevant to the Black community? Is the message relevant to the Hispanic community?
Camello says these are things city and state officials need to consider more of so everyone can have a fair share to getting vaccinated.
The state is changing. And so we need to adapt as well our processes, our access, and how our states reach out to these communities, because as the time goes by, Connecticut's getting more and more.
Experts urge every person of color who has not taken the vaccine in the state to seriously consider doing so, especially for those who are currently eligible. Fox 61 has a full list of resources inside the Fox 61 website and mobile app. In New Britain, Brian Ditlake with the Fox 61 vaccination team.